In 2021, I began to have a very dry cough, and then I began to have difficulty climbing stairs or doing a little more extensive things, and I thought, oh my gosh, I'm really out of shape. And it just kind of kept progressing, and then I finally said, I got to go see someone, and I went to see Dr. Buckley at IU Health, and she did test and diagnosed me at that point. That was January of 22 with idiopathic pulmonary fibrosis. And then her already talking at that time about, you know, eventually you're going to need a transplant. When I first found out I had this, I began to research it, and with the education you found out you had 3 to 5 years without a transplant. And no, I can't do that. I'm too young, I have too much to live for, and so I just have to push through it.
I'm Dr. Denlinger. I'm the Chief of Thoracic Surgery, also the Program Director for the Lung Transplant Program.
And once I met that team, I knew right then that IU was the place to be. That team made me feel assured that they could handle this, because I'm in a space where I've never been, and so I need somebody to guide me through that.
The pre-transplant is a major commitment on the patient and their family. I do like meeting the patients early on in the info session and seeing what they're like, what questions they have, what's on their mind. There are 2 really important aspects of the info session. One, as the name suggests, is really to inform the patient what transplant is all about, and to present it in realistic terms, so they walk away with some understanding of what their disease is, what their state of disease progression is, and what transplant might have to offer. The second major component of the info session is to help us understand where they are in their disease state. Of course, we get plenty of records from the referring physicians, and we have a pretty good idea, but we also do tests like x-rays and pulmonary function tests, and do a frailty assessment. Based on their disease, their category, and also their state of progression, then we decide when the next step should be, and we call that next step the evaluation, where they come here typically for 3 days with lots of interviews with the entire team, probably 10 or 15 different interviews with different team members, and 3 days of invasive testing to assess their cardiac function, their lung function, liver, kidneys, physical therapy. We assess everything.
I mean, they checked me from head to toe, and everyone was so caring here. If I didn't know where I was going, they left their station and would take me there and explain the test. And then when I went back, they ran through all the results of the test with me.
It's all about optimization. So we optimize their medical conditions like diabetes and blood pressure. We optimize their rehab potential through physical therapy. We optimize their infectious issues. We optimize nutrition. The whole idea is to get them finely tuned as possible to minimize the risks of surgery.
I did pulmonary rehab in Columbus for about 3 months, and I was not obtaining my goals there. And they could see again that my disease was progressing.
As in Tammy's case, the local therapy just isn't quite good enough. We're not comfortable with her level of exercise tolerance, and that would increase the risks of surgery. So we actually required that she move here to Indianapolis to come to the Colt, which in my mind is the best place in the state, maybe the country, to do physical therapy both before and after transplant, where the folks at the Colt are comfortable working with patients like Tammy who have very severe lung disease. They're very comfortable working with people that might need 30 or 40 or 50 liters of oxygen to exercise sufficiently.
We need to get you to that, reach your goal, which I was able to do in 8 days because of that wonderful team over there.
There is a lot of commitment on this team, and even more commitment on the patient and their support team, their family. There's a lot that goes into getting through the evaluation. There's lots of appointments, lots of tests, and some patients decide very early that transplant is not for them, and that's entirely fine. But once they actually get to that big day where they're listed, it's a huge deal.
I'm on the list now, effective a week ago, so I'm just hanging in there, keeping my strength up. Could be today, could be a week, could be a month, but they seem to think it'll happen soon.